For the past few weeks, I have been creating videos related to inpatient medical coding Q&A. In the first video, I have provided 100 plus inpatient coding Q&A and which lasts for 42 minutes 27 seconds. In the second video, I have provided nearly 25 Q&A related to inpatient coding and it lasts for 24.54 seconds. And please note that these are the interview questions I have segregated and collected from our students who have attended most of the Indian medical coding companies for inpatient medical coding. Today we will learn 25 plus latest inpatient coding common Q&A part 3. So if you missed part 1 and part 2, please watch part 2 and part 3 too. In the part 2, we have stopped at what is sequela. So any condition developed after acute phase of illness or injury called as sequela. So mostly we will use 7th character S for the sequelas. What is the difference between DNR and palliative care? DNR means do not resuscitate or do not resuscitate. So in DNR, the patient will not accept CPR. They want to have natural death. What is palliative care? So palliative care is specialized medical care for people living with serious illness. So this type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality life for both the patient and the family. So basically in palliative care, physician will provide treatment for serious illness. Next one, when we code GCS. So GCS means Glasgow Coma Scale. So we will code GCS only for traumatic head injury, including ICH, intracerebral hemorrhage, SDS, subdural hemorrhage, SAH and subarachnoid hemorrhage. Mostly we will use GCS Glasgow Coma Scale for traumatic head injuries. When do we code NIHSS National Institute of Health Stroke Scale Score? So we will use NIHSS score only for acute CVA cases. Next one, the patient admitted for stage 3 pressure ulcer during the hospital developed stage 4. How to code this scenario? So basically when the patient admitted, so ulcer stage is 3, but after the admission into the hospital, it converts into or developed into stage 4. So in this scenario, we will code both stage 3 POA yes and stage 4 POA no. Next one, anemia due to any cancer. What is the PDX? So basically patient is having anemia as well as cancer, but patient's anemia due to cancer. How do we code this scenario? In this situation, we will code cancer as the PDX and anemia due to cancer as combination code as secondary, because anemia is the manifestation of cancer. So based on coding guidelines, we will not code manifestations as PDX. What is HAC? Hospital acquired conditions. Give me some examples. So basically HAC means these conditions will be most of the time occur in patient's hospital stay. Common example, foreign object retained after surgery, air embolism, blood incapacity, or stage 3 and 4 pressure ulcer, pulse and trauma, fracture, dislocations, intracranial injuries, crushing injuries, burns, other injuries, manifestations of poor glycemic control. Okay, so diabetic ketoacidosis, non-ketotic hyperosmolar coma, hypoglycemic coma, secondary diabetes with ketoacidosis, secondary diabetes with hyperosmolarity. So these are the common conditions we will observe for hospital acquired conditions. So and also includes vascular catheter associated infections, gastroenterostomy, laparoscopic gastric restrictive surgery, surgical site infection following certain orthopedic procedures. These all are HAC condition, hospital acquired conditions, and also procedures related to neck, shoulder, elbow and so on. What is measurement and monitoring? Basically we will use in the PCS. So measurement describes a single level taken at a point of time and monitoring describes series of tests performed respectively over a period of time. So basically measurement means single value. Monitoring means we will get values over a period of time. So measurement and monitoring is the fourth section of medical and surgical group in the ICD-10 PCS. What is the difference between assistance and performance? So it is the fifth section of medical and surgical group of PCS. The extracorporeal assistance and performance section for procedures where equipment outside the body used to assist or perform physiological function. These are three root operations we have: assistance, performance and restoration. So for assistance you will use 5A0. For performance you will use 5A1. For assistance supports function but does not fully replace it. Okay. So what is ECMO? Extracorporeal membrane oxygenation. Is a blood is pumped outside of your body to heart lung mission that removes carbon dioxide and sends oxygen filled blood back to tissues in the body. So basically using the ECMO, extracorporeal membrane oxygenation. Here patient will pump human blood into the heart lung mission where heart lung mission will remove carbon dioxide and sends oxygen to the blood tissues. What is Impella? So the Impella device is a catheter based miniatured ventricular assistive device that pumps blood from left ventricle into ascending aorta. What is a baclofen pump? So basically baclofen pump is a pain management pump. Most of the time patient will insert this baclofen pump to reduce the pain. Using this pump, patient will administer medication in the form of liquid. So next one, the patient is admitted with dehydration given IV fluids. Dehydration is due to cancer. What is the PDX? So in this scenario, we will use dehydration as the PDX and cancer by site as secondary based on ICD-10 guidelines. So what is the root operation for thrombectomy? So extirpation is the root operation for thrombectomy. So next one, meconium staining indicators. So meconium staining. So apnea, bluish skin in infants, breathing problem, limpness in infants at birth. So basically these are the symptoms of meconium. So if you see these symptoms in the infant, you need to consider patient is having meconium staining. Okay. Next, what is late preterm infant? Okay. So this is the do not assign a cared for late preterm infant. Query the physician whether the newborn is smaller for dates or large for dates. As ICD-10 does not have any code for late preterm infant. What is Whipple procedure? So other name for Whipple procedure is pancreaticoduodenectomy. Is a multi-part surgery where patient will perform for pancreatic cancer. Here patient will remove pancreas as well as duodenum. And also patient may perform this procedure for tumor, cyst and other disorders of the pancreas. So these are the other literature related to this Whipple procedure. Okay, so we have two types of Whipple procedures, conventional Whipple and the pylorus sparing Whipple. So based on the documentation, we need to code. So what is the root operation for sternal wire removal? So extirpation is the root operation for sternal wire removal. So how do we code? Laparoscopic cholecystectomy converted to open. So we need to code it as open cholecystectomy and we need to code for laparoscopy infection. And also based on ICD-10 we need to code for laparoscopy procedure converted to open. Next, how to raise a query? First we select the appropriate query template like PO query, established query, reason for admission query. So basically this query template is based on your client. So you need to follow your client guidelines. But in the interview, if they ask you how to raise a query, you need to follow all these steps. Okay. So abdominal aortic aneurysm repair with graft root operation. So we will use restriction as the root operation for abdominal aortic aneurysm repair. Okay. So next one, a patient with history of HIV presents with recurrent pneumonia. When a patient has a history of HIV and presents due to recurrent pneumonia, which code is more appropriate, B20 or G21? Is recurrent pneumonia considered an AIDS defining condition or illness? So basically here patient is having HIV as well as recurrent pneumonia. So how do we code this scenario? And also, can we use current diagnosis of B20 or history of G21 for HIV? Here we need to code G21, asymptomatic HIV. So here basically we need to check the documentation. If the provider does not document pneumonia is due to HIV related illness, we need to use G21 and we will not use B20. So what is the root operation for cesarean? So extraction is the root operation for cesarean section. What is CABG? Coronary artery bypass graft is the surgical treatment for CAD. Here patient will bypass the coronary arteries of the heart. What is functional quadriplegia? So functional quadriplegia is the complete inability to move due to severe disability or paralysis caused by another medical condition without physical injury or damage to the spinal cord. So last one for today's session. What is the difference between replacement and transfer? In replacement, patient will remove the native tissue and joint. He will insert the implant. In transfer, patient will transfer from one location to another location. Here patient will not replace anything. Okay team, so thanks for watching this session. If anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if you like this session, please click on like button. And also if anyone looking for same day surgery coding training, IPDRG coding training, SCC coding training, CCS certification training, please contact 707-526-3939.